Hello again, everyone. My name is Trevor Cox, and I'm excited to share this week's patient presentation with everyone. First, to introduce this patient, I'm going to review the patient profile with everyone. This patient is 70 years old, male, height of 6 feet, weight of 244 pounds, and a BMI of 33.1. His ideal body weight is 78 kilograms or 171 pounds. And we were consulted on this patient due to the length of stay being 6 days, and there was no weight trend given. Next, moving into the medical history, this patient was admitted for general weakness. However, this doesn't indicate much for us as registered dietitians, so we had to dive deeper into the chart for this patient and saw that he was a fall risk. He has hyperkalemia. He is on hemodialysis due to end-stage renal disease, and he also has atrial fibrillation with RVR. He also has type 2 diabetes, and he is on long-term use of insulin. And he also has many other health conditions that we had to consider when making our nutrition diagnosis for this patient. Moving into the lab test, as you can see for this patient, there were a lot of abnormal lab test values. Looking at sodium, that was low. And I also wanted to bring everyone's attention to the BUN and creatinine levels, which you can see are quite a bit higher than the normal range. And this is due to the patient's end-stage renal disease. Also, seeing that he has low calcium, and then lastly, he has a high glucose of 169, and this is primarily due to his type 2 diabetes. And just as we reviewed the abnormal lab values, let's look at some of those medications and treatments that we use to treat those. First, looking at the calcitrol, this is to treat the hypocalcemia. This patient also has hypertension, so they are on a beta blocker. They're also on long-acting insulin, and the primary use of insulin is to lower the blood glucose, and this is a fast-acting, and that's to stabilize the blood glucose levels for their type 2 diabetes. This patient also has hyperthyroidism, so has medication to treat that. This patient is also on vasopressors, also on a proton pump inhibitor, which decreases the gastric acid output. Also on medication to lower the LDL cholesterol, and then also on a phosphate binder, and this is to prevent hypocalcemia. Next, I wanted to briefly touch on the social and lifestyle history and also the NFPE. All of these we were unable to obtain, and we did not perform an NFPE due to the reason for the consult, which is length of stay. However, indicated in his chart, he does have gangrene of the left foot due to the peripheral vascular disease, which we will discuss later. So after we have reviewed the past history and some pertinent information on the patient, let's move right into the nutrition assessment. So as mentioned previously, this evaluation was completed due to the length of stay. This was day 6 of inadequate energy intake. So we are recommending nutrition support via NG tube or enteral nutrition. This patient also had a EF of 40 to 45% without vegetations as indicated from the echocardiogram, and also had some other surgeries while admitted into the hospital. This patient does have a poor appetite, and their current diet is a carbohydrate controlled renal diet because the patient is on dialysis. We're also recommending oral nutrition support of Nepro BID or twice a day. Moving into the estimated energy needs for this patient, we used Mifflin St. Jean to calculate this and calculated that the low energy needs due to the stress and activity levels was 2,289.6 kcals, and the high energy needs was 2,480 calories. The protein range was 133 grams to 166 grams, which was used with a 1.2 to 1.5 grams per kilogram of actual body weight. Moving into the fluid requirements or recommendations, looking at 1,200 to 1,500 milliliters. And this was based on the urine output. There was actually no documented urine output. However, we don't believe this to be accurate. However, based on that, that's how we got the fluid calculations. And the reasoning for these numbers and what kind of went into this was because this patient is on dialysis and also due to the hyponatremia. This is the following PS statement that I have derived and created, and goes as stated: increased nutrient needs related to increased demand for nutrients and wound healing, as evidenced by peripheral vascular disease of the left foot. So for the nutrition intervention, we are recommending food and or nutrient delivery. Also, modified composition of meals and snacks due to the current diagnosis of the patient. We are also recommending nutrition supplement therapy of Nepro and enteral nutrition. For the monitoring and evaluation of the ADIME, we are looking at the biochemical labs and data. Also, we are monitoring for the tolerance of diet and the nutrition support. We are also monitoring the procedures and medical tests. Lastly, I created this plan of action to summarize all the data that we have seen today. This is day 6 of inadequate oral intake. We are recommending nutrition support via enteral nutrition via a nasogastric tube. The goal rate is Nepro at 70 mLs per hour, giving the patient 3,024 kcals, 136 grams of protein, and 1,221 milliliters of free water. We are also recommending a non-mineral multivitamin and Juven BID or twice a day to assist with wound healing due to the gangrene of the left foot. The last bowel movement for this patient was 317 or 3 days ago, and so we are also recommending to start a bowel regimen. Thank you, and everyone have a great day.